This is a congenital defect in the heart that happens in utero, or in the womb rather, where there is a hole in between the two ventricular chambers of the heart. So this condition is common and of course it's known in children, and also is the commonest congenital heart defect. It's also more common in females than it is in male children. In this condition, children can present in different ways. Babies in particular can present with profuse sweating when they are breastfeeding or feeding, or they can present with difficulties in breathing. The symptoms are dependent according to the size of the hole between the two chambers. So those with particularly small ones may not even present. They may not know that they have it. But those ones with moderate size or larger size defects, they can present much sooner to us. And these ones have varying symptoms depending on, of course, as I said, the size. These are children that will often have recurrent respiratory tract infection. They will have this chronic cough. And these are children that are small for age. So the child may not be gaining weight according to their age and their sex. At national heart hospitals, we do see a lot of these babies that come in with ventricular septal defects. So these babies the treatment varies according to, as well as the size and the way they present. So in children that are relatively stable, we treat them with medication to help prevent them into going into cardiac failure. So in the other ones, the surgery is recommended for the ones with moderate ventricular septal defects and the ones with larger ventricular septal defects. Operations can vary. Either they can do an open heart surgery, or they can go in through the catheterization and put a stent in between the two ventricles. Basically a patch between the two ventricles. It's just an operation to repair the defect that is there, basically close the hole that is there to prevent the mixing of oxygenated and deoxygenated blood, because this is the major complication in patients that they can present in heart failure, because they're not getting enough oxygen to the rest of the body, and the heart is working too hard to provide that oxygen. Most of these, this congenital heart disease, they are genetic, may happen because of a family line, or it could be an environmental cause, yes. But there's no particular predisposition to have them, no. They can be affected by the environment in which the mother is in while she is pregnant, and maybe some substances that she may have taken during pregnancy. Alcohol and smoking is one of the most important risk factors in such congenital heart defects in general. The general consensus is that these children are destined to not go so far in life, in that they will not live for a long time. But that's not true. Depending on the defect and how we can manage it, some of these patients make it and live a relatively normal life. It should be something that should also be in under 5 clinics. It's something that we should be looking for, especially in children that are failing to thrive. It's something that we should have at the back of our minds, that this could be a congenital heart defect, especially if a child is coming in recurrent pneumonias or recurrent coughs. It's something that we should think of and try and assess and screen those patients for such a condition.